Using blood to heal, one of medicine's best kept secrets. Platelet-rich plasma, or PRP, is a form of regenerative medicine that involves using a patient's own blood, which is processed to concentrate the platelets and growth factors, and then injected into the injured area to promote healing. Using blood to heal may be one of medicine's best kept secrets, but before we dive into the secrets of PRP, make sure to subscribe to our YouTube channel and hit the bell icon. Platelets are known to contain various growth factors that can promote healing and tissue regeneration, such as platelet-derived growth factor, transforming growth factor beta, and vascular endothelial growth factor that can stimulate healing of soft tissue and bone. It is a treatment option for knee arthritis, a condition characterized by inflammation, degeneration, and loss of cartilage in the knee joint. The therapy involves injecting a concentrate of platelets and growth factors taken from a patient's own blood into the affected knee joint. The growth factors in the PRP stimulate the healing of damaged cartilage and reduce inflammation. Several professional athletes have undergone platelet-rich plasma treatment for knee injuries. This includes basketball players like Kobe Bryant and Dwight Howard, baseball player Alex Rodriguez, and tennis players like Rafael Nadal and Maria Sharapova. Some studies have shown that PRP therapy can improve pain, function, and range of motion in patients with knee arthritis. The process typically begins with a blood draw from the patient. The blood is then placed in a centrifuge, which spins the blood at high speeds to separate the red blood cells from the plasma and platelets. The concentrated platelets, which contain growth factors, are then collected and mixed with some of the patient's plasma to create the PRP. The concentrated PRP is then injected into the affected area using a small needle. The injection site is typically numbed using a local anesthetic to minimize discomfort. The procedure typically takes about 30 minutes to 1 hour, and the patient can go home the same day. PRP injection is usually done by a doctor or a specialist. It's a simple procedure, but it's important that it's done correctly to ensure maximum benefits. The number of injections will depend on the condition that's being treated and the doctor's recommendation. PRP is usually administered under ultrasound guidance. Ultrasound-guided knee injection is a procedure that uses ultrasound imaging to guide the placement of a needle or other instrument into the knee joint to administer medication or other substances. During the procedure, the patient is positioned on an exam table and the knee is cleaned and covered with a sterile drape. The practitioner will then use an ultrasound machine to create real-time images of the knee joint and surrounding structures. This allows them to see the location of the needle or instrument in relation to the joint and avoid any surrounding structures such as blood vessels, nerves, and tendons. The practitioner will then inject the medication or other substance into the knee joint, which will help reduce pain and inflammation, promote healing, and improve function. Ultrasound-guided knee injections are considered to be safe, accurate, and relatively non-invasive. They can be used to deliver a variety of medications such as corticosteroids, hyaluronic acid, and PRP. They provide an accurate way of delivering the medication to the targeted area, reducing the risk of complications and increasing the chances of treatment success. The cost of platelet-rich plasma therapy can vary depending on a number of factors, including the location of the clinic or facility providing the treatment, the specific condition being treated, and the number of injections required. On average, PRP therapy can cost between $500 and $2,500 per injection. Some insurance companies may cover the cost of PRP therapy if it is being used to treat a specific condition, such as osteoarthritis. However, in most cases, PRP therapy is considered an elective procedure, so it may not be covered by insurance. It is important to note that the cost of the therapy may vary greatly depending on the location and the provider. It's always best to check with the clinic or facility providing the treatment for the most accurate cost estimate. Here are a few things to consider when looking for the best clinic for PRP injections. 1. Look for a licensed and accredited clinic. Make sure the clinic you choose is licensed by the state and accredited by a reputable organization. 2. Research the practitioner's qualifications. Look for a practitioner who qualifies and is experienced in administering PRP injections. This may include doctors and nurse practitioners who have specialized training in regenerative medicine. 3. Read reviews and check ratings. Look for reviews and ratings for the clinic and practitioner online. This can give you an idea of the experiences of other patients and help you make an informed decision. 4. Ask about the type of equipment and procedure. Different clinics may use different types of equipment and techniques for PRP therapy. Ask about the specific equipment and procedure used at the clinic to ensure it is up to date and meets the latest standards. 5. Get a consultation. Schedule a consultation with the practitioner to discuss your condition and treatment options. This will give you an opportunity to ask questions and make sure you feel comfortable with the practitioner and the clinic. Hope you learned valuable information about PRP and regenerative medicine today, and comment below if you have any questions. Make sure to hit the like and subscribe button below to get the newest news about the world of rehabilitation, regenerative, and pain medicine.